Hello, I'm Dr. Greer Stewart, the Assistant Dean for Medical Education at the University of Alabama College of Community Health Sciences, the Tuscaloosa Regional Campus of the UAB School of Medicine. And it is my pleasure to talk with you today about the UAB School of Medicine's primary care track. So why did we want to start the primary care track? We have an interest in increasing the number of primary care physicians, but more than that, we want to develop doctors with an interest and understanding of community-based medicine, regardless of the specialty they pursue. We want to educate students to work in these environments and develop the knowledge and skills, not just the medical side, but also the business and leadership side. First, let's look at the 4 years. Years 1 and 2 take place in Birmingham with the rest of the School of Medicine students completing the basic science curriculum. Our students will have primary care elective and research opportunities, and will have primary care introduction to clinical medicine experiences. During the clinical years 3 and 4, is where most of the difference is. The clinical years are based out of the Tuscaloosa Regional Campus at the University of Alabama. Year 3 consists of the Longitudinal integrated Clerkship. Students also participate in Relate, an almost weekly discussion forum with myriad topics and speakers, and LCPM, our Leadership in Community and Population Medicine course. Year 4 consists of 3 4-week acting internships in community medicine, inpatient medicine, and acute care medicine, which must be completed in Tuscaloosa at one of our approved community sites. There's also a 2-week prep for residency course, and then there are 18 weeks of electives, which can be completed at any of our campuses or with an approved visiting elective. Let's talk more about the third-year curriculum. All School of Medicine students complete the same core clerkships in medicine, pediatrics, surgery, OBGYN, psychiatry, neurology, and of course, family medicine. But in the primary care track, these are completed with a 12-month longitudinal curriculum rather than the straight 4 or 8-week blocks. We did not invent the LIC. This is just a sampling of some of the schools that utilize this type of curriculum. If anyone can claim inventing the LIC, it's probably Minnesota. They started theirs approximately 50 years ago. That being said, every LIC is unique, defined by structure, environment, and the needs of the state and the institution. Since these programs have been around for a while, however, we do have some good evidence regarding their effectiveness and success. Students are more patient-centered, tend to rate their education higher, and do at least as well on standardized tests as their more traditionally trained counterparts. We've been doing this in Tuscaloosa for a while now. We are 7 years out from our initial pilot students, and in our third year of having all of our students participate in the LIC. Our students work closely with their preceptors in all of their clerkship disciplines and get to follow their patients over time. During year 3, all of our students complete half of their year in a primarily inpatient modified blocks, which we call the Tuscaloosa Immersion Experience. The other half of the year is integrated, which I'll explain a little bit more about in a moment. Most students will complete this in Tuscaloosa. However, a few students will be selected through an application process, which takes place during second year, to participate in our community integration experience. The Tuscaloosa integration experience involves working with preceptors in different disciplines each half day of the week. These preceptors are in Tuscaloosa and primarily working at the University Medical Center, which is our teaching practice here on campus. The community integration experience allows students a similar education, but working in one of our approved community hubs around the state. These preceptors are practicing physicians who are trained by our staff to provide an excellent educational experience for our students. In addition to what students will see and learn in Tuscaloosa, these students will see what private practice is all about, see the business end of medicine, and learn how small town doctors are integrated into their communities. So this slide shows on top what the Tuscaloosa immersion experience might look like. The modified block experiences that are primarily inpatient and are similar to what you might experience on one of our other campuses. Below that is a sample of a typical 2-week cycle for the Tuscaloosa integration experience. As you can see, each half day has different activities interspersed with study or elective time, group didactic sessions, and of course our LCPM and Relate experiences. This cycle would then repeat over and over through the half year that is the integration experience. Overall, our students have really enjoyed the LIC. We have made changes based on feedback and will continue to do so. But our students have all said they would do it again, and they feel that this is a more student-centric curriculum and really feel like they get to know their patients and their preceptors. Students feel more like they're part of the team. So, summing up, students get primary care mentorship over the 4 years. The LIC provides a unique opportunity for medical education and learning about patients and the business side of medicine. We are also doing an excellent job of preparing our students for internship and beyond. I know you have questions, and it is my hope that you will apply to the primary care track, and then I'll have the opportunity to answer these questions. When you have your interview with the School of Medicine will be when this occurs. Best of luck to you as you move forward in your education. Thank you for your time, and I hope to see you soon.